My name is Megan. I'm a physical therapist. I own a clinic in Brown City and I spend my day seeing patients. I've always liked exercise, sports, movement, and wasn't really sure what I wanted to do. And I knew I didn't really want to be a nurse. I didn't really like the hospital setting. So I found this career and I like it. My day includes a lot of different things. I work with people most of the day. But the other big part of my job is paperwork. So in order to get paid for services, there's a lot of paperwork that goes along with it, writing what you do with people and then sending things to insurance companies or organizing things that way. So half of it with people and the other half with office type work. Favorite part is being up and moving, working with people, doing exercise type stuff or movement. Definitely least favorite part is the paperwork. Some days when I have a lot of new people, I spend a lot more time doing paperwork, but on an average day when you're just seeing people after they've been evaluated, I see a lot of patients, so I spend maybe 3/4 seeing patients and 1/4 doing paperwork. The good thing about it, it's a variety type job, so you could be on your feet for a little bit, you could sit for a little bit, you could be at your desk for a little bit. You're working with your hands, you're moving, so I feel like the variety of things make it so it's a tolerable job. I'm not doing the same repetitive motion all day long, and you see a lot of variety of people. So, you know, one minute I might be showing somebody exercises for my arm, but the next thing I might be showing exercises for the leg, and I feel like that helps balance out the day. So I don't go home hurting or anything. Physical therapy, I feel like can be described a lot of different ways, but 3 things that I think of when I think of therapy are like movement, function, and pain. So we primarily see people because they're having trouble doing something. So if I have a hard time walking, whether it's because I have pain or weakness or stiffness, there's a lot of reasons why someone can't do something. So we can see people for a lot of different reasons, but we usually see them because they're having a hard time doing something, whether it's participating in sport or reaching in a cupboard or rolling over in bed. So we see people usually for movement dysfunctions or things that affect their normal activity. Because of that, like there's a wide range of patients that can be seen. So like we see babies, like if babies have developmental delay or different reasons why they're not moving or doing things like they're supposed to be, all the way up until 100-year-old people who want to be able to walk still. So there's a wide range of people and there's a wide variety of type of things you would see, anywhere from like people who've had maybe amputations or people who've had surgery or just because you have pain or lots of different things, which makes it fun. That's the cool thing about physical therapy. You see a wide variety of people. One of the things about therapy now that they have is you can get specialized in certain things. So my specialty is orthopedics. So in general, things that would come into an outpatient orthopedic clinic are like orthopedic type things, whether it's sports related or a knee joint or a back or a shoulder joint, something like that. But that doesn't mean that I'm not skilled in seeing somebody who's had a stroke or kids. Like kids can pediatrics, so you can specialize in something, but you also can see a wide variety of people. In a rural setting like Brown City, you get a lot of different things, which makes it fun. It mixes things up. So that's the other good thing about the profession is there's a lot of different places that you can work. So outpatient clinic is one. So being at a facility out like in an office building. The other place is like home care, so you can travel to people's houses to see people who can't get out to see you, you go see them. You can work in the hospital, so you can work in like all different places too. You can work in the intensive care, you can work on a regular orthopedic floor or a cardiac floor, any different floor of the hospital, you'll see physical therapists. You can work in rehab centers, nursing homes, schools, especially big schools, they'll have their own physical therapists on staff. But for like Brown City, there's physical therapists that work for different counties that go from different schools to help kids that need help. So you could do a lot of different things with this job. There are physical therapists that work for professional sports teams, college sports teams. You definitely could get a job in just the sports setting. So that's the thing about it too. If you work in a general setting, you can see a lot of different things. But if you have a passion for kids or if you have a passion for sports, you can get into a very specialized job working just with that specific people group, I guess. There's a lot of different ways you can help somebody. So some of the things we do are hands-on. So whether it's stretching someone's shoulder and stretching them through motion, so we're touching them, mobilizing their joint, so doing joint mobilization type stuff. Some of the things we do are exercise. So if we're working on stretching or strengthening, obviously having the patient go through stuff and show them different movements, that's helpful. We have modalities, which is like alternative things that can help ease people's pain, like a hot pack or a cold pack or electrical stimulation to get a muscle working. So those are considered modalities. Patient education is considered something that we do. So teach people like, well, why do we hurt and how can we help that? How can we move better, movement quality, safety. So there's a whole bunch of things on how to help prevent falls. So teaching people stuff. There's a lot of different ways it could look, I guess. I used to work in the hospital on weekends, and there are some patients that need a lot more help, and it would, I'm not physically able to lift a ton of weight, but it's not impossible because there's other people. You don't necessarily go by yourself. You grab a nurse aide or you grab another physical therapist or an assistant. So you're working in teams. And if the patient is, having a really hard time, there's mechanical lifts and all different kinds of things to help people move. So it's definitely not impossible regardless of your size. When it comes to personality, I'm an introvert. I don't necessarily love huge crowds of people or getting up in front of a room full of people always, but I feel like regardless of your personality, it can suit people because I'm an introvert. Like, I work with people one-on-one. I'm not like standing up in front of a bunch of people, so working with people all day isn't a huge deal. And where we're at, it's super laid back. People are usually fun. Physical therapists are usually funny, fun people, relax. They usually like sports type stuff. You don't have to, but typically we're not like, I don't know. It's not like a competitive, it is a competitive program, but we're always physical therapists, I feel like, are helpful people. So it's just pretty low key and pretty fun. Even other clinics that I've worked at, I've always had a great time, and I still am friends with my past coworkers. One of the reasons I got into this actually was I went and did a job shadow. So when I was in college, one of my classes required me, and I didn't even think of this before, but it was super helpful. They had me go on job shadow, and I'm like, well, that sounds like a interesting job. So I went to a therapy clinic, and that's where you got to kind of see, like, you're in it. I would just recommend going to different settings because one job doesn't necessarily look the same as another. So like whatever job, if you're interested in engineering, what does that even look like? Well, obviously there's a whole bunch of different kinds of engineers and all their jobs could look different. So when you get out there and see, people are usually really helpful. With students just asked to stop in and observe, that's usually welcomed, and I feel like it gives you a better idea of whether or not you think that you would be a good fit for it. To be a physical therapist, it's a doctorate degree, so it could take you 7 to 8 years of schooling. And to be a physical therapist assistant, it's an associate's degree. So depending on the program that you're in, they're usually like 2 to 3 years. You do have to get higher grades though to be in the healthcare field in general. So whether you're going for a nurse or a doctor or a physical therapist or a dentist, there tend to be competitive programs, which means you have to stay on top of your stuff because there's a lot of people that apply. So there's like a whole application process. So you have to want to do it, I feel like, to do it, but it doesn't mean anybody can't. So the great thing about school is sometimes people feel intimidated, but there are tutors and counselors and teachers that are great, professors that are willing to work with you. If you want to do it, you can. The beginning is a lot of book work. You have to memorize like all your muscles, all your bones, all your nerves. Those are ways you can prepare. If you like the health field, those are kind of things you can start looking at and practicing. Flashcards, there's a ton of anatomy apps. So the first part is you have to understand what's in the body, how it works, and then after that you can start with application stuff, which is a lot of hands-on labs, movement. It's fun. Schooling's expensive in general. There's a lot of better ways I feel like you can go about college, whether it's scholarships or having a job during college or, to try to not take out debt. There's ways to be smart financially about this job, but obviously depending on how long you go to school for, so an assistant isn't as costly as a physical therapist, but to be a physical therapist, it's a long-term investment. You have to have a license to be an assistant or a therapist. And so when you're done with the program and you pass not only the book portion, but the clinical portion, which is like on the site, like an internship, I guess, when you pass both of those parts, you have to take a test that's per state. So each state has certain rules, and you take that state exam and they give you your license. You have to be able to pass that. So if you don't, they won't give you a license. But again, there's a lot of ways that they work with you to get you prepared for that. In the healthcare field, you have to continue to learn. So I have to take so many courses every year to keep up my license. This can be done online, in person, but you have to keep learning to keep up to date, and it is a requirement. If you're going to be a physical therapist and you want to commit seven years of schooling for that, or 8 years, making sure that that's what you like, going out and getting exposed to stuff, I feel like that's helpful. If you aren't sure, but you actually like the profession, if you're not sure if you can do it, I would encourage you to go for it. I just feel like there's a lot of help out there that sometimes we don't realize, and knowing that we can ask for help is great. And like, if you're interested in even just checking out the field, stop in. We can show you around, or be willing to go to a hospital. There's a lot of places that you can go that people are willing to help you, even if you're just looking to observe. I felt like in high school they made it seem really intimidating to go to college, and that's why I keep saying that there are a lot of resources to help people, and I don't want it to be an intimidating process, because I felt like that my freshman year. My parents didn't go to college, and I was like one of the first in our family to go besides my brother, and I just didn't really know the process, and it was really confusing to me, and I was shy, and the counselor, I just felt like I didn't know what was happening. So I would just tell people, reach out, because there's a ton of resources, and I don't think it has to be as intimidating as you might think. To get into a program, whether you want to be an assistant or a physical therapist, you have to observe in different settings for so many hours. So if you're interested in getting in the field, like, look into the requirements that it takes, because even when you're taking like your beginner classes or college classes, like, you could be taking ones that both fulfill the requirement to get into a program and are your basic college classes. So like, looking at see what the college requires, which you can just call up or look at their website to see. You have to like to learn. So this job is always changing, medical field in general. You're learning new stuff, learning better ways to help people. So if you're not interested in keeping up to date on stuff and keep learning, like, and you just enjoy learning, I feel like I wouldn't go into a health care type field. So in a job where you see sadness or people having a hard time with things, like, you have to be okay with that and being able to be bright and helpful regardless. So I just know sometimes it brings people down when they see other people hurting, so maybe that would be not a great thing. If you're logical and you like problem solving, physical therapy is a good job, because a lot of times you do that, especially in an outpatient setting. But there's many parts of this job that you care for people, and being compassionate and being willing to help people, even though every day you're seeing people, that are having trouble, you can still go in the next day and have a open heart and like care about these people. I feel like that's important.
On a scale of 0 to 10, how much do you regret being a PT?
Wait, 0 is I regret, or 0 is I don't regret?
It's up to you.
No, I don't. I'll give it a 1 in on either scale. Not that I regret it, but I don't know. You can't give something 100. I don't know.
Coffee or tea?
Coffee.
Dark or white chocolate?
Why not milk chocolate in between?
A book or a movie?
Outside? I don't really like to sit still that long.
Aquatic therapy. Do you know how to swim?
You don't see a pool in here, do you?
Would you rather be chased by a bear that can fly or a shark that can run?
A bear that can fly or a shark that can run? Bear. Only because I like fuzzy animals better.